Now on BBC Radio 4, The Simulated Patient, presented by Francis Burns. In the old days, doctors learned to develop their bedside manner on the job from older doctors. Nowadays, all medical students are taught communication skills by actors. What's the difference, though, and what does it all mean?
Hi there, I'm Kyle. I'm a first-year medical student. If you'd like to take a seat. Hi there. Would it be okay if I just had a talk with you before you went in to see the doctor today?
Yes, of course.
Is that okay, is it?
Yeah.
Interesting that Kyle sat down sometime after the lady and is kind of fairly reluctant. The lady looks incredibly sad.
Just maybe help me sleep. I don't seem to be able to sleep, and I thought he might be able to give me some pills or something that would help.
We're listening to a young man being trained to be a doctor.
And how many hours of sleep do you feel that you're getting each night?
It's his body language that the tutor is assessing, not the patient's, because Kyle, a first year at Glasgow University, is being taught how to have a bedside manner. He's learning how to nod, grunt and flash. He takes classes in empathy. I don't know when people started to use that word empathy in an everyday way, but I don't think Dr. McGrowther, a Glaswegian GP, mentioned it much. His son, Professor Gus McGrowther, is an eminent hand surgeon.
I'm not sure I've ever really analysed my own bedside manner. One of the first jobs I did was as a general practitioner in the Highlands of Scotland, and it really was like Dr. Finlay. The patients relied on you for information. They didn't have much information on their health, and they really believed everything the doctor said. When I was very young, my father was a GP, and I used to sit in his surgery. My father set me standards, and his bedside manner was exemplified by the fact that when he died, the streets were lined with his patients on the way to the cemetery. In a slum district in Glasgow, he had an excellent bedside manner without them feeling he was in any way looking down to them or looking up to them. He dealt with all his patients equally, and that was an example that's really a hard example to follow.
Some older medics are sceptical that bedside manner can be taught formulaically in class. They think that the best way to learn is on the job. Jan Clyde, who was a district nurse in the Gorbals in the 1960s, found a mentor.
The nurse that I was with taught me everything that I know about basic good nursing and general politeness to patients. And I think even now I do things and I think, oh, Sister MacDonald told me that. Everything regarding people, and not to look at where they lived or what they looked like, but to think of how they lived. And they had a table that was scrubbed on a regular basis. And this is where we delivered babies, do dressings, always on this very shiny scrubbed wooden table. Sister MacDonald was a one-off now when I think about it. She would alter so much if a patient was ill and genuinely ill. And I think that's where we learnt the bedside manner. Rather than just being polite and nice to the patients, she did teach us to observe. And by that, you became involved in the family. And you knew how, there was one family you could talk to quite openly and nice, but there would be another family you would go to and she'd say, now, just be careful what you say. They've had this, somebody's died, somebody's out of work. Be kind.
The ideal doctor shows a profound interest in the patient's problem. They pay complete attention to them. They advance without prejudgment, presuming nothing. A kind of fictional Victorian detective deducing things while never forgetting their manners.
If I think how I've developed my bedside manner, it first of all comes from my mother, who just taught me to be polite, to quote her words. There's something of the example of my father, and then from all the doctors I worked with, by following their example, by seeing how they communicate with patients, I've learned none of my bedside manner from a book. and going to courses on equal opportunities, and it's not that develops a bedside manner. It is basically, I think, a certain type of humanity.
Things have changed. In the early 1990s, the European Working Time Directive made it illegal for doctors to be on call for such long hours. Doctors now had less time for consultations. Something had to be done. In a document called Tomorrow's Doctors, the General Medical Council recommended wide-scale training in bedside manner, not as a nicety. The rapport the students must learn is functional. One of the tools in this training is the simulated patient, an actor. At the end of year exams, the trainee medic must make a diagnosis of a simulated ailment in front of an examiner before a bell rings and the student moves on to the next role play, where another disease awaits. The actor, Phil Harrison, is a simulated patient in Sheffield.
It's a great big open-air stadium. Hundreds of students converge on this stadium. People know Monty Python, but the sketches where somebody knocks on the door and says, is this the right room for an argument? And it's almost like that. The thing is, really, you don't give a performance. The whole idea is you play it as a real human being, as you would yourself. It is suspension of disbelief on their part as well.
And so you're repeating every 5 minutes. Is it lasts 5 minutes?
Those are usually 5 minutes, yes. Some are 10. It used to be 8, I think, at one time. The G.P'S say this when we're working with them. They say often you have even less time than this. So for things like rapport building, you only have at most about 30 seconds if you're lucky, really.
Hi, is there Mary Graham here?
Yeah, that's me.
If you could follow me.
These are the newest recruits at Glasgow Medical School. 6 months ago, they were at school. Phil Cotton, a senior lecturer in general practice, gives us a commentary as he and about 10 students watch Kyle build rapport with a simulated patient, Mary. Kyle knows nothing of her history.
She's now crying. He's leaning even further forward now.
And it's kind of lost contact with people, really. People ring me up and leave messages, and I don't bother to get back to them.
When he's maintaining his regard for her, he's remaining completely still, hardly any fidgeting at all.
It's okay. Is this because you feel that you're just tired all the time?
I just feel so lonely. Terribly lonely.
Leaning even further towards her.
My husband Michael died 3 years ago. His anniversary is next week. And I just miss him so much.
He's just sitting very quietly and very still.
I just thought if I could get a decent night's sleep, it would help.
And for him, the most important thing, I think, is not to try and be something that he isn't.
I'm sure there are plenty of reasons to be going on. It's just a matter of picking out what's important and what matters in your
Just
life.
to keep maintaining that
Obviously,
that conversation and that response, that natural, normal response.
and friends, and it's just each day as well. Day like today, where it's nice and sunny, and just bring up your mood. Just taking it like that. But yes, I agree. I think helping you sleep would definitely puts a spring in one step. And
she's now looking at him quite intently.
yeah. Just talking about it is often a really, really good therapeutic method.
It just gives her permission to talk.
I was very happy to listen. So.
And they're looking at each other and nodding with one another and
I
smiling.
can certainly pass what you said on to the doctor. And thank you very much for speaking to me.
Thank you, Kyle. A difficult consultation. Yeah?
Yep.
Yeah.
My palms are sweating.
Your palms are sweating. Okay, carry on telling me how you're feeling.
I wish I could have done more. You always feel that you wish you could do more for people in that situation, but really there's nothing more you can do than just offer support and being there.
Maybe that feeling of wishing you could just do a little bit more is a feeling that stays with you, and 20 years on, it's probably still with me after a fair number of consultations. So, Mary, Penny.
I looked up for the first time, and it was just like the love and the care of somebody looking at you. It was light shining out of your eyes. And that was so warm and so healing. Healing.
Yes. And Beth, you were going to comment for us.
I especially thought when she started crying that you just let her cry, because I think when a patient does start crying, it's really easy to panic.
I wasn't conscious of any of that whilst actually in the consultation. It was just a conversation.
Thank you, and thanks all of you. What I do want you to do, remember, is to write down the feedback that you've got from people, to write that in your reflective log diaries. All of you, yes, indeed. Write it down.
When we first came and had our first communication skills, it was a bit shocking. So I'd rather I had that shock now with actors than with real life patients. Can be terrifying, but that doesn't necessarily mean it's bad.
You have to let them go off on tangents because you never know what the tangent could lead to. I think it's important just to let the patient talk.
I don't know if you can be taught empathy. I think you can be taught how to show empathy. Medical school is probably self-selecting for empathetic people, but it's the being able to express that appropriately and show patients that you do have empathy. That's the part that can probably be taught more, how to bring it out of yourself.
I think what we wouldn't want to do is to train someone to perform.
In communication skills, the students learn acronyms to help remember what to cover in the 5-minute consultation. One acronym is ICE. I, they must extract the patient's idea of what they've got wrong with them. C, the patient's concerns, and E, their expectations of their consultation with the doctor. It's not easy to work through these self-conscious techniques without losing something.
Where someone's taking a history and they will say, just a bit of family history here. What about your parents? Are they still alive and well? You say, well, yeah, my father's alive and well, but my mother died yesterday from horrible cancer. And they say, great, and write down something. And don't realise that what they've said. And that is a classic which comes up all the time. They'll be writing things down and asking the question, not really listening to the answer. Noddy is a classic, and what they call nodding and grunting and flashing, which are classic role-play things. The nodding is fairly self-explanatory. Grunting is just, yes, and just possibly a slightly longer comment to say, yes, I understand that. The flashing is actually the eyes, literally showing with your eyes that you are listening to what they're saying. It ties in with the eye contact. But it's just kind of almost like a twinkle in the eye, which is that you are not just looking at them, staring at them, because even with eye contact, you can be completely blank. And yes, they are trained in all those things. You can be trained in really looking at yourself, possibly being mirrored through other people, where other people are watching you and noting down the kind of things that in real life you don't notice.
Do you ever get yourself in a situation where you feel a little bit like a sponge for pretend empathy?
Yes, sometimes, yeah. You often see, if you like, the technique coming through. If they have been told to do something, you can see it coming through. And they'll often do things by rote.
Caring is great, but it counts for nothing if you're misdiagnosed. I was misdiagnosed by many doctors, then finally someone got it right. Thanks to him and his team, I've survived, but looking back at the conveyor belt of medics I'd seen, the doctor I feel most angry with is the one who'd persuaded me she cared. She'd cocked her head to one side, flashing reassuringly, while she told me there was nothing wrong with me at all. When we go to the doctors, we don't have a clue what's relevant or what's irrelevant. Our fear is that there's some dark story behind our symptoms. The doctor's job isn't just to make a diagnosis.
One of the most important things we do as doctors is to help patients get their story right, to make sense of their stories. And you saw some of that today. Intuitive, normal, just walked in off the street medical students who were saying, "So what you mean is this? It must be pretty difficult, isn't it? Do you not find this? Do you feel that? If I were you, I would feel like that." And that gives me great hope, really, for the future of the doctors that we're producing, that here we've got people who are prepared to listen to people's stories, prepared to make sense of them.
The bedside manner is a very variable commodity. There are various emotions that have to be available from the doctor, but they must be appropriate to the situation. You have to be able to keep switching your emotions. There's maybe a bit of the actor about it, but it's not really an act. It has to be a sincere thing. And the best actors, I think, actually feel the emotions they're expressing. So maybe you're trying to be like a really good actor.
Well, I went to see the specialists at the hospital, and they said that they'd seen shadows on X-rays or something of lung, and that it was definitely lung cancer, metastasized, gone into secondaries, into the liver. I've had prostate cancers. I've pretty well gone right through the whole range of cancers, really. But the strange thing is, I'd never been given leukemia at the Royal Marsden.
Richard Tate is currently on tour playing Corporal Jones in Dad's Army. As a simulated patient, he was highly practiced at describing symptoms. Then one day, he felt out of sorts, for real.
It was July the 24th, 2000. I'd been having these pains in my side, and I'd been to the local pharmacist who suggested charcoal biscuits. So I'd been taking them, but it wasn't improving. So I'd made an appointment with the doctor, and she suggested the blood test. And then about 4 o'clock, she rang. She'd like to see me after surgery. We use the same technique. We call it a sort of a warning shot across the bows. It braced me for bad news, because I thought, why would she want to see me so soon and after surgery? So I went in there, and she told me that I was producing too many white blood cells, and I recognized that and said, well, that sounds like leukemia. And she said, yes, it is. She was as distressed as, well, she was upset. I didn't cry or anything, but I walked back to the house, and I felt as though somebody pulled the power plug out of me. Am I making sense?
Yeah, very, very much so.
When I then went to the hospital, all I could hear was things like 3 to 4 years. Going into the blast stage, I was just hearing these rather frightening headlines, and that's why it was crucial that my daughter was with me to actually find some nuggets of hope amongst all that.
Do you feel then that ill people need a well advocate at their side through all this?
I suppose it depends on the individual, but I'd say quite often, yes. when I'm involved in the simulated patient thing, I often say to the students, it doesn't matter that you didn't give such an amount of information, because I can assure you that the patient at that stage can't digest an enormous amount of information. Even that it's great that I don't want doctors to collude with you and lie, but I think that you can pick out positives. I just remember once I'd worked out this wonderful analogy, and I'd said to a clinician that, oh, I suppose it's a bit like diabetes. As long as it's controlled, it's fine. And she said, no, it's not like that at all. You'll always go into the aggressive stage. And I thought, I think you could have kept that to yourself. Do you see what I mean? I could have done without that. The haematologists at Hammersmith are terrific, and they're full of life. So when I go there, we talk about what I'm up to. They've been to see me at the Palladium and shows and things like that. There I am up there singing, acting, whatever I'm doing, and they're delighted by that.
Do you feel as a patient that you want to please them?
I think you do. Well, I might do, yeah.
Do you think part of wanting to please the doctors is that you may persuade them that you're a patient that's worth saving?
Gosh, that's an awful question, that is. But yes, I have to admit that there might, deep down, hidden away, there might be that. Yes, that's spot on. I feel embarrassed about it now.
Why?
But yes. Well, that it is like that. You are sort of saying, you're asking them to prioritize in a sense, aren't you? You're saying, look at me, can you keep me going a bit longer because I'm worthy of it?
Do you think, having been such a practiced patient as a simulated patient, that you'd learnt how to be effective at describing symptoms and knew what the doctors needed to know?
Yes, I think it has helped. I don't know, I might have meandered on with all kinds of things, but gradually, yes, I have learned to perhaps pinpoint things which would be helpful in coming up with the phrase that they use, a differential diagnosis, yeah.
In the future, perhaps we'll need to attend role-playing sessions with simulated doctors to learn how to be the good patient. We have so many different relationships with our doctors in our journey through life and disease, and we expect different things from them at different times. We want the relationship to be most meaningful and somehow equal at the point at which we're most dependent on them. Then the doctor whose skill and attentiveness seems beyond their job description can seem to us, if not godlike, then ancient, a healer, one of the wise. No wonder we have a complicated relationship with this figure who stands between us and our death.
There was a very famous surgeon in France in the 1800s called Baron Dupuytren, and he removed a cancer from a man's jaw before anaesthetics. Now think about that. He took his jaw out without an anaesthetic. And at the end of the operation, the patient said to him, probably not speaking very clearly, he said, well, Baron, thank you for this operation. Either you will be at my funeral or I will be at yours. And 20 years later, the patient went to Dupuytren's funeral. So on occasions, I've said that to some of my patients, you know, either you will be at my funeral or I'll be at yours. So that's the ultimate in bedside manner, where you develop a relationship with a patient which is bonded in the fact that you've come through a long period of difficult treatment together, and you've both come out at the other end feeling that you've done your best and they feel you've done your best.
After Richard Tate went into remission, he was keen to continue his work as a simulated patient. A shattering illness in his own life has forever altered his role play.
I think it has moderated it, yes, but it makes me think twice before I suddenly try to go for a BAFTA award with it, you know, and start. It's not the same histrionics, no.
Right. Do you now play roles in which the scenario requires you to be at a very advanced or final stage cancer?
Sometimes, yes.
Do you feel that you're anticipating something that's ahead of you?
I try not to think on that level too much. It's a bit like getting a bad review as an actor. That's the one you always remember. And I cannot shake out of my head that senior nurse saying to me, "Oh no, it always goes into the aggressive stage." I should shake it out, shouldn't I?
I don't think you can decide on these things. Do you think you can?
I don't know. I could have done without that.
The humaneness was lacking.
Yes.
Yeah, absolutely.
Yes.
Richard, where do you think your best performances have been, on the stage or as a simulated patient?
The truth is, you see, I wouldn't use the word performance when I'm talking about simulated patient. That's exactly what I'm trying to get away from. Some of the most moving moments for me have been actually working with doctors.
That was The Simulated Patient, presented by Francis Burns. Richard Tate is with professional role players. It was researched by Carolyn Barber and produced by Matt Thompson. The Simulated Patient was a Loftus production for BBC Radio 4. In a moment, an astrophysicist looks at images that have transformed science.